So in South Africa at the present time, the diagnosis situation is rather complicated. We estimate that probably 1.6% of the population are infected, have active tuberculosis disease. Probably a third of the population are latently infected with tuberculosis. Transmission is very rapid in crowded communities such as the townships in South Africa. So you've got a high burden of disease, a dense population. It's of critical importance to be able to identify people who really are sick as quickly as possible, both to start their treatment but also to isolate them from spreading disease further within their communities. We're aiming to develop a new class of point-of-care diagnostic device that will fundamentally improve the information content coming out of tests made at the point of care with the view to improving the overall performance of diagnostic assays. Our technology will fulfill the global health need of providing more accurate and rapid diagnosis of patients whilst the patients are standing in front of a clinician. So the vision for our technology is to build a handheld battery-operated device, probably about the size of a cell phone, into which we can incorporate a low-cost disposable item, perhaps the size of a coin. That coin-type disposable device will contain all the components for the individual assays. And by putting a biological specimen onto that coin, whether it's blood or saliva sample, we can then make multiplexed readings for many different pathogens in parallel. We can work out what the disease might be, we can work out what strain type of disease the patient might be infected with, and therefore we can help the doctors to work out what treatment should be prescribed. The capacity to come up with something tangible that will be used in real life and will alter the way in which diagnosis and treatment of individuals is made in resource-poor settings, that's exciting stuff, for sure.